We have entered a new phase of COVID-19. The number of cases is dropping, vaccinations are increasing, and some limitations on gatherings have started to change. But of course, COVID-19 is not over. In today's To Your Wellbeing, what steps you still need to follow as we enter this new phase of COVID-19. Wesley Long Hospital's Chief Medical Officer, Dr. Jeffery Hatcher, is joining us to talk about that. So first and foremost, let's talk about what the numbers are, the current numbers are related to COVID-19 today.
So as of right now, there have been 29 million cases of COVID worldwide. We've seen a significant drop off in the number of cases nationally and locally, whereas in Greensboro, in the Cone Health system in the middle of January, there were about 300 cases within our health system. Today, there were 50.
Wow, so that is a huge difference. Okay, so with those kinds of numbers, those kinds of improved numbers, I think a lot of people will start to think, all right, so COVID-19 is over.
Yeah, that's a common thought. The problem is that this is not over. This is a infectious disease. It's going to be around for a while until we get everybody up and fully vaccinated.
All right, so then their next question is, how long do I have to keep doing all the things that you've been telling me to do since all of this started in March of 2020? How important are those 3 W's in this next phase?
Yeah, those are still super important. If we look at the data from our analytics folks here at Cone Health, so much of the gains we've made have been from vaccines, but a lot of the gains are from our behavioral changes, whether it's masking, staying 6 feet apart, washing our hands. They've made huge changes, and if we let those go, we're likely to see some regression.
And that is kind of like my follow-up question. What is your worry of that people will go back to the pre-pandemic ways too soon? What will happen?
Yeah, well, I'm very scared that we'll see a lot more cases. I think that we have some gatherings coming up that could see some significant spikes in our area. Certainly what's going on in Florida right now is sort of the test case for what could happen around things like spring break. Certainly Easter is a potential for a big spreading event in terms of families getting together.
All right, so then how important are vaccinations in continuing as we advance through this next phase? We know that the 3 W's are still important. You said that may be even bigger than the vaccinations, but how important are vaccinations continuing?
Yeah, our vaccination efforts are really key right now in terms of what's going to happen for this infection going through this part of the year and then also going into the fall. We're really hoping to get vaccinations up to between 70 and 80%, or at least 70 or 80% of the population. So that'll give us a really great chance of getting what people would call herd immunity and then getting this under control.
Yeah, I was just reading today about how Chile is one of the first countries to be able to get this herd immunity. So what percentage of the total population needs to be vaccinated here in order to get back to more normalcy?
Yeah, so hoping for around 70 to 80%. At Cone Health, our employees, we've gotten vaccinated up to about 60% right now who've gotten their first vaccine and 56% on their second vaccine. But if you look at the North Carolina numbers, it's only 20% of people have gotten their first vaccine and 13% have gotten their second. In Guilford County, we're about the same. 21% of people have gotten their first and 11% have completed the vaccine.
All right, so then for people who may still be hesitant about getting the vaccine, what types of things would you be telling them now, especially since they're hearing stories of people who've already gotten their vaccine?
Yeah, I think that the best advertisement for the vaccine are the people who've already gotten it. The majority of people never had any side effects from the vaccine. It was a very simple process, very well tolerated, no side effects. So when I got the vaccine back in September through a clinical trial, I thought that I'd gotten the placebo. So I think that most people don't really have any significant side effects or even any minor side effects from having gotten the vaccine.
We are dealing with those new variants. Let's talk about those new variants and then what people should do to prevent catching those new variants and spreading them.
So the major variants right now are the UK strain, which there is some of in the United States. There's not a tremendous amount of it in North Carolina, very few cases. And then the Brazil strain, and then the South African strain. What we worry about those is increasing rates of contagiousness in terms of how spreadable they are within communities. There are also some differences, some subtle differences in the way that they interact or that they respond to the vaccine. But in terms of what to do to keep from getting them, is really will rely on getting the vaccine, which will give you some protection, and then also maintaining those 3 Ws.
And then what other steps do you think need to be done for us to move forward? Because we all just want to continue to move forward.
Yeah, a good friend of mine was just saying this weekend about how really sick of this she is and how tired she is of wearing masks. And I think that's very common right now after a year of this. And I think we're close, and the more we stick to this right now in terms of sticking with getting our vaccines, washing our hands, keeping our distance 6 feet, and wearing a mask, the more quickly we'll get to the finish line.
Well, Dr. Hatcher is going to be with us until 6 o'clock answering your coronavirus question. So how do you get your question to the doctor? Well, you text that question. The number's on your screen right now, 336-379-5775. Remember, this is text only. Please don't call. Text your question, and we'll be back.